Welcome back. League tables of the best and worst performing NHS trusts in England have been published for the first time. The government says each trust will be ranked quarterly on the standards of its services, from urgent and emergency care to elective operations and mental health support. Earlier, Health Secretary Wes Streeting told us the rankings are about transparency.
The reason we're doing this is firstly to make sure that patients are better informed and are able to exercise choice, but also so that consistent with the approach I've taken since I became Health Secretary last year, making sure that we have honesty, transparency and honesty about the variation in performance.
Our health correspondent Laura Bundock joins us now. Laura, tell us a bit more about the tables and I guess who's come out on top and bottom.
Yeah, well, each of the NHS trusts have been put into one of these three league tables, and the tables are basically for acute trusts, that is basically what we call hospitals, non-acute, which is more community-based mental health services, and then the ambulance trusts. They are ranked according to a number of different measures, including things like how long people have to wait in A&E, how long they have to wait for operations, and how the finances of the trusts are being managed as well. Within each of those three tables, the trusts are then put into four different categories, one being the highest, four being the lowest. And when we're looking at the acute trusts, the hospital trusts, of those 134 trusts, 104 of them are falling in the bottom two categories, meaning they're basically not performing as well as they should. So let's take a little bit more look at the tables at the moment. Let's look at the tables for some of those better performing hospitals. For the acute trust, most of those places, the top slots, the 8 top spots are filled by these specialist hospitals. So you can see there, number 1, Moorfields Eye Hospital. Moving down to the other less non-specialist hospitals, you then got Northumbria Healthcare NHS Trust. That is the best in England. That's at number 9, followed by University College London Hospitals at number 10. These are the places people will want to go to. At the bottom of that table, the worst 3 in England, according to these tables, are at 132, that is University Hospitals Coventry and Warwickshire. Just below that, the Countess of Chester, that's where Lucy Letby, of course, worked. And the worst is the Queen Elizabeth in King's Lynn. It gives patients an idea. What does it mean? Well, CEOs from those trusts at the top could get bigger bonuses, and they definitely will get more say over how the budgets are spent. Those in charge running the ones at the bottom could eventually see their pay cut, and they could get their bonuses docked, if you like. So that's the state of play with these tables.
And Laura, in terms of the response that we've got so far, is the sector, I mean, one can imagine if you're in charge of a successful trust, you'll probably be quite pleased, and unsuccessful one you won't be. But what's been the sort of spectrum of responses?
Look, I think there's a lot of debate about do we need league tables, yes or no. I think the question is, if you are starting to name and shame trusts, is it actually starting to give us a sense of identifying what's really going on? They are controversial. Look, Wes Streeting will say it gives patients better information, it will identify, it will support those who are struggling, so people don't face this postcode lottery. At the moment, we've got a situation where patients in King's Lynn don't have as good a deal as patients who are going up to Northumberland. The worry, I think, about league tables is what they're measuring and whether that is the thing that really matters for patients. And are they actually identifying these league tables the best performing hospitals? One ranking could hide a lot of differences within departments across one hospital. And there is this other fear as well. If you put pressure on staff to do better with league tables, it could lead to a culture of cover-up. And that is exactly what we saw in the case of Stafford, where there was a scandal at the hospital which saw hundreds of people die due to poor care that simply wasn't spoken about. It was covered up at the time. So they are controversial, but they're coming in, and we're going to get these 4 times a year, every 3 months now.